The Chereponi District Hospital in the Northeast region is considering a return to the cash and carry system due to weeks of power outages affecting the entire district. Hospital management states that they can no longer afford the cost of fuel to power their generator and cover other operational expenses. For nearly 2 weeks, the entire Chereponi district has been plunged into darkness, making life difficult for residents. Our Northeast regional correspondent Mohammed Aminu M. Alabira visited the area to assess the situation and filed this report.
They said that light is life, and for the people of Chereponi district in the Northeast region, the past 2 weeks have underscored the importance of electricity. Life in the district has become unbearable without power, severely disrupting daily living. The absence of electricity has paralyzed economic and social activities. By 6 p.m., Chereponi town and the entire district are enveloped in darkness, with all shops and activities coming to a standstill. One of the worst affected places is the Chereponi District Hospital. Without electricity, residents are left vulnerable to mosquito bites, leading to increased illness. Patients flock to the hospital, but the lack of power has made it difficult for hospital staff to provide adequate care. Whilst the hospital has been running on a generator, the cost of fuel is unsustainable. Hospital management has initiated discussions with the Health Insurance Authority to temporarily revert to the cash and carry system until power is restored. Mohammed Aliu Salana, the medical superintendent of the Chereponi district, spoke to ChannelOne about the challenges they are facing.
Almost every blessed day, we have persistent light of at least not less than 12 hours in a day. And for a hospital that totally runs on a software system, without power, you cannot work. The LIMS is what almost every hospital in the entire country survives on. And I don't know the plans that were put in place before the introduction of the software system. Now, the LIMS doesn't make provision for you to save when you are doing your consultation. So along the line, when the light goes off, you are compelled to lose every data you were capturing.
He explained that the hospital is considering returning to the cash and carry system to cover operational costs during this power crisis. He also appealed to the government as well as charitable organizations and individuals for support.
My plan is to meet with the health insurance people to see whether we can revert back to the folder system for the meantime until the problem is solved. In no time, we have students, they are preparing to write a WASI. Without light, anxiety will set in, possibly some of them will develop BPs. Traders cannot go about meaningful trading, and I am sure we are going to record high number of hypertensives. And if this issue is not addressed, it will consequently impact on other aspects of our lives.
A doctor working in the emergency ward echoed the medical superintendent's sentiment, describing the difficulties they face due to the lack of electricity.
At the stores, because we don't have light, most of the medicine expires. Most of the medicine that need constant cooling or at a certain temperature, we cannot store them. And most of the drugs, we don't even have a fridge for them. So we are forced to always go outside to buy. We are planning to start to stop the national health insurance because the internal guarantee fund is not enough. It cannot keep up with we cannot buy the fuel again. So we are starting next week to be charging the patients so that we will get money to fuel the generator to be able to take care of them.
Despite these challenges, patients and their relatives praise the hospital staff for their dedication and care. Here are some of the patients and relatives speaking to ChannelOne News.
Fortunately, I brought my father here. In the night, for instance, if there's no light, how can they work for us to take for those that they are in the hospital here? So we are also need the light so that they can help us.